In this video, I'll teach you everything you need to know to use a birth ball in your pregnancy safely and effectively so you can feel your best as your pregnancy progresses and you can optimally prepare your body for birth. If you're new here, welcome. My name is Melissa. I am a Yoga Alliance certified yoga teacher and certified prenatal yoga teacher and a natural birthing mama currently pregnant with my second baby. I have an anatomy certification from Yale and I'm trained in the spinning babies methodology. I specialize in teaching anatomically correct, alignment-based workouts and yoga that you can do throughout your pregnancy to relieve pregnancy aches, pains, and discomforts while optimally preparing your body for birth. So if you're new here, tap that subscribe button and the bell icon so you don't miss out. In this video, you will learn how to use a birth ball and warning signs to look out for, the correct way to sit on your birth ball that encourages optimal anatomical alignment for both you and your growing baby, and 5 exercises that you can do every day in your pregnancy to keep your body strong, balanced, and flexible. Remember, your baby and your body is growing every single day, so we want to do some gentle exercises every day to accommodate your body's growing needs. Did you know that there's actually a lot that you can do during your pregnancy that will influence your labor and birth experience? It's a very empowering process. In my opinion, a birth ball is the absolute best, most effective pregnancy wellness tool that you can use. A birth ball is a simple, super effective tool that you can use to manage, alleviate, and even prevent so many common pregnancy discomforts like back pain, sciatica, hemorrhoids, constipation, swelling, and so much more. A properly sized, properly inflated birth ball encourages your body into optimal anatomical positioning, sitting upright and tall on your ischial tuberosities, those bony bits at the bottom of your pelvis that support your spine and support your best posture. This proper foundation is the cornerstone of supporting your body's changing anatomy through all of the stages of pregnancy. So there are so many benefits to the birth ball. As I mentioned, it is the #1 tool that I recommend to all of my prenatal yoga students. So before we dive into the basics of how to safely and effectively use a birth ball so that you can get the maximum benefits, let's just share what some of those benefits are. So as I mentioned, a birth ball improves your posture. Sitting on your birth ball properly encourages your body into optimal anatomical alignment. Sitting up tall on your sits bones, those bony bits at the bottom of your pelvis that you can feel if you move some flesh around, sitting on those all the way up through your spine and through the crown of your head. As your belly grows rapidly and your center of gravity shifts, there's additional strain placed on your soft tissues. And that tends to cause some rounding or hunching in the upper back and maybe some spinal lordosis, or just like letting the belly hang forward in a really extreme arch of your lower back. So as you can imagine, this causes upper back pain, shoulder tension, lower back pain, pelvic pain. Just so you're inviting a whole host of discomfort in this suboptimal posture. And the posture that's created when sitting on your birth ball in the 3rd trimester is especially important because it can have a very significant impact on your baby's final position, how they settle into your belly to get ready for birth, which can have a really profound impact on your labor, how smooth your labor progresses, if there are labor stalls. And we'll just get into that a lot more in other videos, but for now, just know that that's really, really important to consider. So the birth ball is also a really great way to exercise your pelvic floor muscles. You're probably hearing a lot about the pelvic floor and kind of curious, what exactly is it? What exactly does it mean? How do I work it out? What do I do with that? And we'll talk about that in other videos. But for now, just know that using a birth ball encourages your core and pelvic floor to work as it should, as it's functionally designed to do so. So this lengthens and strengthens your pelvic floor muscles, which can aid in your labor and your postpartum recovery. So again, we'll dive into the pelvic floor in other videos, but for now, it's important to know, to understand that you need a pelvic floor that is both strong and tensile, meaning strong and flexible. We don't want one that is overly tense or tight, and we don't want one that is overly loose and not supportive enough. So having that balance of the two is really important. As I mentioned earlier, sitting on a birth ball can reduce or prevent pelvic floor pain, hemorrhoids, constipation, indigestion, and other really unpleasant pregnancy symptoms. So those natural, gentle swaying and rocking motions that you will find yourself doing when you sit on your birth ball help to alleviate back pain by strengthening and lengthening the muscles and ligaments that support your growing uterus and the weight of your baby. The supple, giving nature of the ball, you know how it has that soft, rubbery bounce, it gives a little bit when you sit on it as opposed to a chair. That helps to reduce the pressure on your pelvic floor and can significantly help to reduce hemorrhoids. The wide supportive surface of the birth ball can provide relief from hip pain, lower back pain, even sciatic nerve pain by allowing your hips to open and stretch, and it relieves pressure and it improves your flexibility. It also relieves pregnancy constipation naturally. You may notice even in your first trimester that the shifting hormones has caused some constipation, which gets very uncomfortable very quickly. But sitting on the ball, again, an optimal posture aligns everything, including your digestive organs, and just helps things move and flow more naturally. The birth ball, I mean, I could just sing its praises all day long. It encourages optimal fetal positioning when you use your birth ball properly, especially in the third trimester. So spending time on your birth ball daily helps to facilitate optimal fetal positioning for birth. An optimal head down occipito-anterior position, meaning baby's occiput, the back of baby's head, is facing the front of your body. Now, we don't have to think about this much until the third trimester, because that's when baby settles in, and it's quite towards the end of the third trimester that baby settles into their final position before birth. But the work that we do throughout pregnancy helps to prepare your body and create space for baby to have that room in order to rotate properly. What you do need to know now is that fetal positioning has a very significant impact on your labor progression. It can reduce labor stalls, it can help labor to progress smoothly and rapidly, and all of these things can help to prevent unplanned or unintended interventions. And the last benefit I'll mention right now is that the birth ball helps to promote optimal circulation. So the gentle movement, again, that gentle sort of like organic, natural rocking and swaying motion that you'll find yourself in if you're sitting on the ball, can have a significant impact on your circulation and even maybe swelling, especially if you sit for long periods of time. Maybe you work at a desk, you work at a computer all day long, and great circulation, of course, is optimal for your and your baby's health. So there are lots of other benefits that I can explain in other videos, but for now, what you need to know is that you are doing something awesome for yourself and your baby by choosing to utilize a birth ball. And the sooner you start, the better you'll feel, the more you'll get to reap those benefits. So if you don't yet have a birth ball, today is the day to order one. If you're curious about the birth ball that I use or the one that I recommend, I'll link it in the description box below, along with a chart to tell you what size to get based on your height, because it is very important that you use the correct size ball. I'll dive deep into that in a separate video, but for now, just know you can follow that quick chart to get you started. So if you like this video, take a second to hit that thumbs up button and make sure to subscribe if you haven't, but hitting that like really helps to support my channel so that I can continue making free resources for you. So moving on, when should you start using a birth ball? Well, as you probably already picked up on, the sooner you start using it, the better. So if you're in your first trimester, this is a great time to get the ball incorporated into your daily routine. If you're in your second trimester, let's go. It's time. Your body is starting to grow and change. And if you're in your third trimester, the time is, now to do the work to prepare your body for birth. Plus, you're probably feeling some aches and pains by now that, you'd like to have some relief from. So go ahead and give the ball a try to make your pregnancy more comfortable. And it's also a really amazing tool that you can use during your labor, which again, I'll explain in other videos. But it's never too early to start using a birth ball. So the most basic thing you will do with your birth ball is sit on it. And it sounds really straightforward, but there's actually a couple of cues that you need to know in the back of your mind to ensure that you're doing it properly and safely. So first, you need to have the proper size ball. And again, I'll link a little ball chart based on your height in the box below, but I'm also gonna do a separate video all about why and how to do some fit checks to make sure that you have the right size ball. But the first point is to get the right size ball for your body. So for now, know that when you are sitting on your birth ball, your hip creases need to be at or above the top of your knees. So if your hips are sinking below your knees, what that does is it actually encourages your femurs or your thigh bones into internal rotation, which kind of dumps everything forward. It causes your lower back to round, your spine to round. What we want to do is support that nice, tall, upright posture. So when you're sitting on the ball, think of sitting in a tripod or like a 3-pronged support. The triangle or the tripod, the triangle is the most supportive shape that we have. You'll see triangles all over our bodies. The soles of our feet are triangles. That supports our body standing upright. And there's lots of other instances of that, but just know that you want a nice, wide, healthy base of support. So when you're sitting down, you're sitting up on those sits bones, nice and tall. The soles of your feet are flat on the floor, sitting at about, a 45-degree angle from your hips or whatever is comfortable. You don't want to be too tight and you don't want to be, terribly wide, but just something that feels comfortable here. This nice, strong base of support so that when you sway side to side, you don't want to fall. There's a risk of falling in pregnancy as your center of gravity changes, so you just want to feel comfortably supported when you're on the ball. So another really important point to think about is please no socks. Again, you don't want to slip. You don't want to be on a slippery surface. I also mentioned having the right size ball, but part of that is making sure that your ball is inflated properly. So typically when you get your ball home and you blow it up, it usually comes with a foot pump. You inflate that ball. You'll find that even when it feels fully inflated, it maybe looks a little bit wrinkly still. Let the ball sit for 24 hours or so. Come back the next day. Add a little bit more air. You'll find that there's still a little bit more room as the ball kind of settles in. So go ahead and top it off and then start doing your fit check. Sit somewhere where you can hold on to something for support, sit on the ball, make sure it's the proper height. Your hips are at or above the tops of your knees when your feet are nice and wide, and that you feel comfortable on the ball. If you find that your hips are sinking lower than your knees, that's an indication that you need to add more air or possibly that you have a ball that is too small. Okay, so you now have lots of knowledge about the birth ball, about why it's an incredible tool, how it's going to help you feel your best in your growing pregnant body, and some quick tips on how to use it safely. Now let's learn just 5 quick movements you can do on the ball every day to help your body feel its best. So the first one is just a gentle side-to-side swaying, rocking motion. Think of your pelvis or your hips as a boat just gently rocking on the ocean. Or imagine, your baby in your belly. You're just gently rocking your baby to sleep, lulling your baby to sleep. Just a nice, gentle motion. The second great movement you can do every day is a figure 8. So make sure that when you do a figure 8, you're doing it in both directions. There's a tendency to think that because you go around and around, you're doing it in both directions. But actually, if you lead with your right hip, go up towards the front of your right foot, come back down, making a circle with that hip, reaching the left hip up towards the left foot and come back down to center and continue that motion. Next, if you want to reverse that, you could start with your left hip or your right hip and bring it back first and go back and then up towards the foot and come down and back towards the other hip and up. So thinking about doing those figure 8s in both directions. I don't know why I find that like a bit of a mental exercise, especially when my mind is trying to tie it to my body moving in space. But just think about that, continue to do it in both directions. And number 3, nice and simple, just do some big hip circles. Imagine your pelvis, that nice strong base of support that you're sitting on is like a big pencil, and you're just drawing a big circle all the way through your hips, moving on that ball. The ball's gonna make an awesome, embarrassing squeaky sound. That's cool. Go in both directions. Again, it's gonna feel really good on your lower back. Oh my gosh, this was always my favorite movement when my belly was really, really big when I was pregnant with my daughter. But yeah, you'll love this. It feels so good in the pelvis and the lower back. Movement number 4 are pelvic tilts. So if you've ever done like a cat-cow stretch on the ground on all fours where your pelvis tilts up and then it tilts down, think of doing that as you're sitting on the ball. Okay, so when you're doing your pelvic tilts on the ball, go ahead and bring your hands to your hip bones, your ilium. You'll feel the top part, that's the bone that forms like a big round arch on either side. You can feel the top of those, your iliac crest. Rest your hands on those, and then you can kind of feel if your pelvis is upright or if it's tilting back. You'll notice that your thumbs point back towards the ground, and if you come back upright, things point up towards the sky. And as you tilt your pelvis forward, you can feel those thumbs kind of moving forward with your pelvis. That helps you to find that alignment. So again, just pelvic tilts, tilting back, like a gentle relaxation in the lower back, coming upright and tilting the pelvis forward, moving through that a few times as that feels good. And that 5th and final move that I'd like to suggest that you try doing every day is getting down on the floor. You're on your knees and on your shins here with the ball in front of you. You can gently hug the ball, Drape your arms, maybe drape your chest, the side of your face, over the ball, like you're giving the ball a hug. And that allows your belly to have a little bit of space, to kind of hang out in space. Your upper body is supported by the ball. Your lower body is supported by the ground. Your knees are on the ground. And that's a nice, really like counter stretch, or just kind of an anti-gravity release on your back. And you can just gently rock side to side here on the ball. Try flipping your head to the other side, resting on the other cheek, just so you don't cause any strain in one side of the neck or the other. So we always want to kind of be balanced here, left to right. But again, just swaying side to side. That's a really beautiful, gentle way to kind of wind down from the day. So what questions do you have? Drop them in the comments below and let me know if you have used a birth ball before, or if you've not, if you're gonna go ahead and start using one in this pregnancy. If you're interested in joining my email list, I'll leave a link in the description box below. That's where I send new blog posts and new videos directly to my Mama's Mat little community. So be sure to sign up for that if you are liking what you find here. There are so many more ways to prepare your body for birth and have an enjoyable, healthy, fit pregnancy, and I can't wait to share so much more in other videos. So be sure to subscribe, and I'll see you next time.